When it comes to semaglutide, there are three biggest cornerstones, I would say. First of all, it is the starting dose. Second of all, it is the maintenance dose. And the third thing that I should talk about also is the dose escalation. Now, when it comes to the starting dose, like I said, you need to be mindful because people that start with too high of a dose usually get the most amount of side effects in regards to GI distress, fatigue, and headaches. Now, no one wants to deal with that, so let me tell you how to dose your semaglutide properly. The recommended starting dose is 0.25 milligrams a week for the first 4 weeks at least, if you want to be as cautious as possible. It is also intended for the dose escalation. It is not the dose that is going to be the most effective for most amount of people in regards to, for example, glycemic control. Now, usually after first 4 weeks, if you tolerate the dose and you are already adjusted to the dose, there is going to be a dose escalation. The dose escalation is going to be to 0.5 milligrams or 500 micrograms per week. Now, this is the dose that has been shown to make a significant impact when it comes to individuals treated with semaglutide. For example, with the glycemic control, the appetite management, and type 2 diabetes management. But like I said, or like I always say, everybody's different, and that also is true with the dosing of compounds. So 0.5 milligrams, for example, when I want to decrease my appetite and I want to utilize the semaglutide, the 0.5 milligrams is the dose I end up on. Of course, I'm not starting with 0.5 milligrams, especially if I was not using semaglutide for a longer period of time. I always start with 0.25 and then increase to 0.5 milligrams or 500 micrograms. But if you feel like 500 micrograms work, but it can work better, you can increase the dose to, for example, 0.75 milligrams or 1 milligram. And some patients may be eventually prescribed even 2 milligrams per week, which, to be honest with you, I have not encountered in my career or with my clients. Nobody needed that high of a dose. Usually everyone is fine with 0.5 milligrams, with the initial start with 0.25 milligrams. But like I said, if you feel like 0.5 milligrams benefit you, but you feel like you can get better benefit with higher dose, you can try. And if you feel some headaches, some fatigue, some GI distress, you can always lower it to the dose that you were comfortable with. That also applies for the 0.5 milligrams. If you feel like 0.25 milligrams was great for you, you don't have to necessarily push it to 0.5, or if you feel like 0.5 makes you nauseated, have headaches or some GI distress, you can always lower it to 0.25. You don't need to discontinue the compound if the lower dose was working for you. Now, like I said, the dosing with semaglutide is too easy. It's once a week, it's subcutaneous. One pro tip, subcutaneous injections are best when they are done within the glute area. I don't like the abdominal subcutaneous injections. I just don't like it because people that overuse this subcutaneous area can end up with lumps. Again, you don't want to have lumps on a visible space like your abdomen is. So I always encourage people to do their subcutaneous injections within their glute area. It's also fairly big, so you don't have to always inject in the same place. You can go all around the glute area in the subcutaneous space. You have plenty of space there. All of your subcutaneous injections can be done in your glute area. So that is a one pro tip from me to you.